In this video we are going to teach you about Sacubitril-Valsartan or Entresto and SGLT2 inhibitors.
And how these medications may help your heart work better and help you feel better.
This is a combination of two medications, Sacubitril and Valsartan, that work in different ways to help your heart.
Valsartan is an ARB and blocks stress hormones that cause the heart to get weaker and the body to retain too much salt and fluid. Valsartan also relaxes blood vessels. This lowers blood pressure and helps the weakened heart better pump blood out to the body. Sacubitril increases the levels of helpful hormones made by the body called natriuretic peptides. These helpful hormones get rid of extra salt so your body does not retain too much fluid. These natriuretic peptides also help relax blood vessels. Together this reduces the strain on the weak heart and helps it to recover.
A large study showed Sacubitril-Valsartan or Entresto helped people with heart failure live longer and feel better than taking an ACE inhibitor alone.
For the full benefit of these medications, your clinician will increase your dose over time to the goal dose that is most likely to help your heart.
The most common side effect with Sacubitril-Valsartan is dizziness, often related to low blood pressure. Make sure to measure your blood pressure daily.
To help prevent dizziness, change positions slowly and pump your legs up and down prior to standing up.
You can also spread your heart failure medications throughout the day.
If your dizziness doesn't get better, if it lasts longer than a couple of minutes or makes you feel like you may pass out, it is important to tell your clinician. Sacubitril-Valsartan require monitoring potassium levels and kidney function. After starting or changing your Sacubitril-Valsartan dose, your clinician will likely recommend checking blood tests. Changes in your potassium and kidney function can be safely managed with monitoring.
Very rarely, Sacubitril-Valsartan can cause a severe allergic reaction with swelling in your tongue or throat. This is very serious. If it occurs, please seek immediate medical help by calling 911.
Sacubitril-Valsartan should not be taken with other ACE inhibitors like lisinopril or other ARBs like losartan. It is important to wait at least 36 hours after stopping an ACE inhibitor before starting Sacubitril-Valsartan. You should try to avoid NSAIDs like ibuprofen or naproxen with these medications.
You should not take Sacubitril-Valsartan when pregnant or trying to get pregnant.
Many will feel better within a few weeks with using Sacubitril-Valsartan. Others do not feel any different on Sacubitril-Valsartan, but that doesn't mean it's not working. Sacubitril-Valsartan helps prevent your heart from getting weaker in the long run and slows the progression of heart failure.
In this part, we are going to teach you about SGLT2 inhibitors. There are two SGLT2 inhibitors used for patients with heart failure, dapagliflozin and empagliflozin. These two medicines were made to treat diabetes because they cause the kidneys to pee out extra sugar and with it sodium. They have since been found to be effective meds for patients with heart failure even if they do not have diabetes. When the heart is weak, the body retains extra salt and fluid. This increases the pressure inside the heart, making people feel short of breath, leading to heart rhythm problems, and making the heart weaker over time. SGLT2 inhibitors help lower the pressures within the heart. These medications also have other ways in which they help the heart recover and get stronger, and they protect the kidneys from worsening.
Two large clinical trials have shown SGLT2 inhibitors help people with heart failure feel better and be less likely to be hospitalized or die. SGLT2 inhibitors work in a different way than other heart medications like ARBs, beta blockers, and MRAs. Combining these medications is more effective than any single medication. Most people do not have side effects with SGLT2 inhibitors. SGLT2 inhibitors can cause dizziness. It is important to check your blood pressure daily.
Because these medications cause some fluid loss, your clinician may need to adjust your dose of your water pill if you experience dizziness when starting an SGLT2 inhibitor. If you have diabetes and take other medications for your blood sugar, those may need to be adjusted when starting an SGLT2 inhibitor. Rarely, SGLT2 inhibitors can cause yeast infections or urinary infections. It is important to keep the genital area clean and dry after peeing to avoid the sugar being peed out from causing an infection. If you have symptoms of a urinary infection, let your clinician know. Many people feel better shortly after starting an SGLT2 inhibitor. Others do not feel any different once started, but the medication can still be working. SGLT2 inhibitors play an important role in preventing your heart dysfunction from progressing and keeping you out of the hospital.